Get off it. One minute. This plaster needs to be removed. Yeah. Right, so this is day 7. We've done a genioplasty for him. We've done little angle osteoplasty. So you can see how this curved thing has been made straight, giving him a much better chin. We've augmented this area with rib. Little bit of tip work. You can see it's become more pointy than earlier. We've narrowed down the nose. These are the small dots from the osteotomy. So there's still some swelling that you see there. But these are all the procedures that I've done for him. Side view cutting. So yeah, you can appreciate the side view as well. How this jaw, just you can see. Look at this. Straight line, much longer. Look at that. This will get even better. The soft tissue, when it goes inside, right? It's going to get better. The chin height, chin projection, both the sides. Now, this way also you can see the difference. Huge difference will be there like this. Can you see that?
Yeah.
This is sticking out. Now I'll have a nice strong jawline. Nose also you see.
No.
Huh? So it's become really narrow. Okay. More views. So this view you can also appreciate the nose now. So the nose was pretty stubby, short. We've increased the length by starting it or reducing the grooving that was very severe for him. So that's the rib inside. And then the tip, and this alar flaring that you can see was also taken care. So it's got a nice shape now. The columella to alar relationship has been improved, and this is not going to be visible, the scar. You can see how that was earlier. So all in all, multiple improvements in different areas. I keep saying rhinoplasty is a surgery of millimeters. In his case, we've done even jaw surgeries, all millimeters, few millimeters in here, few millimeters out there, few millimeters out, few millimeters in. So we've kind of augmented his pretty much the entire lower third and the nose. You can go back to the front maybe. Right?
I can see like some sort of symmetrical.
That is because of the swelling and all now, right? It has to all heal up. It'll all be fine. See, because the soft tissue swelling can be there for a while. Okay. But otherwise it should be fine. You've taken the scan for him, right? Take it now. It should be fine. Sorry? This side. Okay. Okay. Right.